I'm really happy to be here today, and thank you for inviting me as a special guest. As Kaya mentioned, my background intersects architecture, urban design, and my PhD was in public health. So a lot of the work I do cross-cuts a lot of the themes we've been discussing here, ranging from how people use public spaces in cities, what is comfortable in the context of climate change and warming temperatures, how do we design our public spaces for better outdoor use, and why that makes a difference to neighborhoods, to communities, to vulnerable populations, why that matters for their health and well-being. So today's topic looks at designing public spaces, and I'll specifically focus on examples which look at how we design our streets and plazas. I might have to switch back and forth. So I thought I'll open with an interactive question. So if all of you can scan this code or go to menti.com and put in that code. I'll also write it on the board.
There is a problem. No, I'm good.
Okay. So if you go to menti.com and put in this code, and just add in what you think. When you think of today's context, yesterday we were walking outside in the afternoon, it was very hot. What comes to your mind when you think of health? Is it working on menti.com? Yeah, okay. Whatever, how many ever you, I think it should allow you a maximum of a certain number, but yeah, add as many as you like. Okay, another few seconds and then we will move on. Has everyone almost entered? Yeah. So as you can see, there are some very dominant themes here. And they're all tied to everyday life, how we feel, our health and well-being. So it really makes the point that whatever you're doing here during this week in your professions as you design, how it impacts our health and well-being. At the end of the day, those are the outcomes we measure our quality of life by. The air we breathe, how much access we have to sunlight, nature, green space, access to food, water, air pollution, all of these factors really impact how we operate in our day-to-day lives. And they're really closely connected to the way we design our public spaces. So let's take a quick lesson in history. In traditional times, health was defined in very medical terms. It meant soundness of body. So it meant being efficient in your day-to-day life, how well you can do your tasks. It's connected to spiritual well-being, mental well-being. And it was also tied to how the state, which is in today's context, how your city, how your neighborhood, creates the state of you making you feel safe and protected from injury. And other threats. So these were some of the traditional ways in which health was defined. And going back in time, when we look at how disease shaped society, if you look at this map, ranging from the 1300s, this is a map of the bubonic plague and how it spread from the eastern part of the world all the way through Europe and then made its way to Western Europe. Why is this important and how does this connect to design? This was the movement where our cities developed effective sanitation systems. The importance of public health really came into light because clean air disposal were some of the really important public health crises of that time. And a few years ago, we've had a similar crisis with the COVID pandemic where isolation quarters were set up, we were all asked to quarantine. So we see history repeating itself. And that also affects the way we design our cities. Then that led to the Industrial Revolution, rise of mills, industries, and factories in a lot of the city centers, high demand for housing, but there was also overcrowding and poor sanitation. And that led to the spread of infectious diseases. This really, from this, the field of environmental health emerged. And this map of the cholera outbreak in London is credited for the development of GIS. How many of you use GIS in planning? Yeah, so you're all familiar with the software. So John Snow was the scientist behind who discovered that cholera was actually spreading as a result of the water pump in London because people generally thought it was the air. And this entire field of environmental health was born during this time. Subsequently, a lot of movements emerged in city planning and design. So, for example, the Garden City concepts by Howard. Leonardo da Vinci also sketched out several ideal city designs, looking at gridded street layouts, how to intersperse them with gardens, whether the gardens have to be around the city, in the city. So it led to various configurations. And this movement was also called hygiene by design, which we still see repeating today. Now, that was in the past, so that was quick history lessons. Of course, there were a lot of movements that went on alongside. But let's go forward and flat forward into today's context. So how are cities impacting our lives today? It is very obvious from the two images on the screen which city you would want to live in. And yet, a lot of the cities are consistently facing the situation on the right. So let's look at a scenario. And this scenario is occurring very frequently in countries across the globe, whether it's a developed country, whether it's a low and middle income country. I work with a lot of GPs, medical practitioners, public health practitioners in my research. And this is one scenario that has been playing out very, very frequently. So let's say a 10-year-old boy comes in for a physical exam to the GP. For his age, he's in the 50th percentile for his height and the 95th percentile for his weight. And what this means is he's overweight, he has elevated levels of blood pressure, blood sugar, and cholesterol. He's only 10 years old. He appears somewhat withdrawn. He also shows signs of depression. During the consultation, the doctor learns that the boy is lonely, he's not very good at sports, and he's generally struggling a lot in life. So, what should be the case? Like, what would the doctor ideally recommend? Let's think about that for a minute. What do you think the doctor should do?
Make sport.
Sorry?
It's the
Exercise, yeah. Sorry? Contact with nature, yes.
balanced diet.
Yes, so food, exercise, nature, access to green space. What else?
Contacting with other people.
Social interaction.
Yeah.
Okay, so let's see what happens. Why is this important? So I'll give you a little bit of context. Around 55% of obese children will go on to become obese in adolescence, and this continues further into adulthood. So almost 70% of children who are diagnosed with obesity will be obese over the age of 30. And this is a problem we're seeing globally. There is no country where this is not happening at this point. So yes, like you all suggested, the doctor refers him to a nutritionist. He tells the parent, no soft drinks, reduce the amount of screen time, let's make changes in his lifestyle, get him into an exercise program. So all the things that you all mentioned here today, which is the most obvious solution, right? 2 months later, the child goes back to the doctor for his consultation. He says, I've lost less than half a kg. I don't have space to exercise in my neighborhood. The mother or the parent says, I cannot access healthy food near the house. And 2 months after that, the child is medicated for all the elevated levels that we saw earlier. So how did this problem start? And is it his fault that he's not getting well on his own? What do you think?
Well, there must be also reason related to their societal level, but their the accessibility that he has in exercise.
Yeah, accessing.
Access,
Yes. Okay.
But also is related to the class. His class. If he's more wealthy, maybe he has more accessibility to.
Why is that?
Because sometimes eating healthy, it's eating junk food is cheaper than eating healthy food.
But isn't that the way we are designing our society? Does it mean that if you are, let's say, belonging to the lower socioeconomic strata of society, you're just completely doomed and you don't deserve access to good food and deserve access to park? Yes, somebody else.
People not replace higher income and
Yes.
areas of access, but they're not to public spaces and normal
Yeah.
activities and lower income areas. Then from areas with 6 months away more on their own, more the other one. Also boundaries.
But isn't that our responsibility as designers to reduce gaps? Yes, exactly. Because health inequities are persistent. But in the way we design our public spaces and make them more inclusive for all sections of society is where our responsibility comes in. So we don't generally just design for the rich people. Of course, yes, so be aware of that. So in the field of public health and environmental design, we call this a toxic event, where the way the neighborhood is structured is essentially working against the people who are living there, preventing them from leading a healthy quality of life. This is an example of a study that was done in the UK about a decade ago, but it's again repeating over and over. So if we look at the largest blob, it's a generational map of a family. So this largest one in red is the great-grandfather. From his home, he was allowed to walk 10 kilometers and explore the neighborhood when he was a child. Then we go, and this was in 1919. Then we go to 1950, where the grandfather is allowed to walk 1.5 kilometers. Can you look at how much the circumference has reduced? 1979, just 1 kilometer. And in 2007, the child was allowed to walk only 300 meters. And I think if we do this today, we would probably say children are mostly restricted to their homes or their backyards. So it really speaks to how, as a society, we have shrunken the roaming, it's called the roaming range in literature. How children's roaming range has significantly reduced over the past few decades. In some of the recent literature, it has also been said that despite all the medical advancements and improvements in health, today's children may be the first generation to have a shorter life expectancy than their parents, for all the reasons we have discussed. So let's look at an alternate scenario. What if the child feels safe and supported in his neighborhood? What would this look like? This would mean that he or she is able to play comfortably, does better at school because he's getting exercise, his weight reduces, all the other health parameters are under control, and he also starts making new friends. So you get to know your neighbors better, you get to know the other children better, you interact with them. And if we multiply this by the number of children in each of our countries, what we will see is a sea change. But sadly, the irony is that today, we are designing our environments less and less for movement and activity, and we are becoming more and more sedentary in our daily lives. So this is a cartoon in the New Yorker that really holds true in today's time. And then when we add to this some of the current situation, today, about 3/4 of the world's population lives in cities. And of course, cities are important. They are economic engines, they are powerhouses, they produce a lot of GDP. But at the same time, they're also hotbeds of what I call syndemics. It's not just one health crisis, it's the convergence of multiple crises. We have things like chronic disease. So I spoke about obesity. It's not just in children, it's also happening in adults, all age groups. We have mental health illnesses increasing, road traffic injuries, air pollution, chronic noise, social isolation, safety and crime. And all of this perpetuates health inequities. And then we get to the climate crisis, which is another layer that's being added on to our health crisis. So cities also generate this, because of the number of people living in them, 75% of global energy-related emissions. So what we see is escalating health and social costs. So we have resource depletion, we have the health crisis, we have the climate crisis, and we have aging populations. And that leads me to what I wanted to emphasize as a key concept you should consider in the design. So the social determinants of health, and these are determinants of health and well-being. So if you look at some of these sectors, it's kind of a nested model where we are at the center, and our lifestyle, our community, our local economy are determined by the activities we do, our built environment, and our natural environment. So for example, the way we design our streets, our buildings, our public places, how much access we have to nature, all of this affects our activities. And this ultimately has impacts on the health and well-being of our system. So if you take this and start mapping out as you are doing the design of the square and try and interpret how much of the built environment you can influence to make it better for health and well-being, how much access you will have provide to nature, all of this can impact how people will eventually feel down the road. This graph is especially important because I wanted to emphasize in a person's life, 50% of your health and well-being can be traced back to where you live. And only 20% is access to healthcare. Quite often, we think it's the other way around. But 50% of your daily activities, and that, of course, that includes socioeconomic factors. So we spoke about income, we spoke about class, but then there's also health behaviors and the physical environment. And the better we design this, the better that 50% will be. So health depends more on health systems. And this is where we start getting into the environmental factors, the social factors, and the behavioral factors. And I'm going to get into a project which is tracking some of these indicators globally that I'm working on. One of the models we use is this model. So on the left, you have your environmental design factors, and on the right, you have the healthcare factors. And then these are the exposure pathways. So when we look at transportation, so that includes walking, cycling, access to public transport, land use, walkability, pedestrian environments, and access to green space. So these are the 4 key indicators that are used. And how this affects health is through these pathways. So whether you choose to walk, cycle, or drive depends on how your neighborhood or your daily route is designed, what kind of infrastructure you have. And that in turn affects your BMI, your body mass index, obesity, which then leads to downstream outcomes of chronic disease. The same goes for exposures like air pollution, noise pollution, traffic safety, and crime. All of these exposures are closely connected with environmental factors. And then we get into policy. So it's not just enough, of course, to design them. When we look at cities, municipalities, how they're designed, it is extremely important that there are policies in place so that when the city is being redesigned, as all of you are redesigning the square, how it shapes our travel patterns. And this ultimately affects greenhouse gas emissions as well. So what we need to do, or what I would encourage all of you to think about, is when we think about healthy cities, right now, our efforts are focused here. So we care for sick people, we treat people's illnesses after they have become sick. What we need to shift is supporting people and keeping them healthy so that they don't get into that healthcare system earlier than they should be. Of course, you can't prevent, sickness. We will all be sick at some point. We all will grow old. But the important thing is to keep that transition healthy as much as possible. So one of the projects that does this is the Global Observatory of Healthy and Sustainable Cities. So I've put the website on top. Our overall objective in this project was to map out if cities have these policies in place to deliver health and sustainability goals. As part of this project, so in answering that question, we should keep in mind that a best practice policy, so it should be consistent with the evidence. It has to be very specific and measurable, and it needs to have budgeted options. We all know that money moves things, money talks. So without a specific budget, we're not going to have policies in place.
I think it's a good solution.
Just one thing.
Thank you. So these are the 3 key parameters that we were checking when we mapped cities. And how did we do that? We created a system of scoring, which I will get into. We compared, first we checked, does the city have a policy? What is the quality of the policy? We were benchmarking and monitoring these cities as they were implementing policies, and then also how they informed long-term policy. In this project, we started with about 25 cities, and now our goal is to get to 1,000 cities. So if you scan this QR code, you probably will go to a sign-up event, but we started with 25 cities. We have some of the locations in the world where we are mapping whether these cities have policies or not. I'm sorry, okay, I'll wait till you scan it. If you just go to healthysustainableCities.org, you should be able to sign up at the moment. So these were the indicators that we mapped, about 13 of them, ranging from design, density, how accessible is your closest public transport, disaster mitigation, how the aesthetics are, desirability, diversity, access to employment, destinations, air pollution, how integrated these policies are. These are the indicators we were mapping in each of these cities. This is what our framework looked like. So this is a snapshot of our tool. So we had, this is, sort of the beginning, but we have multiple layers to this tool. And we started mapping these and started coding each of these cities. So it involved liaising with the local municipal departments, having a local team. And simultaneously, we also did spatial indicators. So there's a GIS team looking at spatially how these policies are accessible. So to give you a snapshot, this is what, there were substantial variations in the policy. First of all, if the city had a policy, so it doesn't exist. And then second, what is the quality of that policy? And in order to measure quality, we had several other sub-key indicators as well. And to give you an example, so for instance, if we look at what do we mean by a measurable or a specific policy? Quite often, city planning documents will have very ambitious goals saying, we want to do X, or we want to have X number of public transport options for X population by so and so. But is that really doable? And are they being very specific? Is it connected to the evidence? How is that translating on the ground? So for example, Mexico City had a minimum of 12 square meters of public space per inhabitant. That was their policy for access to public space. In Auckland, their policy for public transport was 95% of the population should live within 500 meters of a public transport stop. These were some of the specific policies we found. Nothing more than this, nothing more detailed. So it really goes to show that cities might have ambitions, but as long as they're specific and measurable, nothing really translates on the ground. All of this work, so we coded these policies, we mapped them out, and that led to, we published this work in the Lancet Global Health, so there are detailed indicators showing this work. On our website, you will also find training videos to show you how you could do this for your city. And we also have scorecards for each city. So for example, this is for Ghent. At the bottom, so okay, I'll start from the top. We coded by percentage how cities were performing spatially. So for example, for Ghent, they were doing really well with public open space. Almost 92.7% of the population had some access to public open space. But they had, minimum density thresholds were not being met. They were doing okay with fresh food and walkability. And if you look at the bottom, these are the policies. So the red ones are where policies exist. So you can clearly see there's a lot of missing policies. So there's missing policies for street connectivity, pedestrian infrastructure, public transport. We also had several global south cities in our sample, so I'll get to that. This is for Lisbon. I added this because, Maria, you're here from Lisbon. We launched this actually with the municipality of Lisbon, and so the mayor had a launch event a few years ago. Lisbon was particularly doing well with public transport, public open space, walkability thresholds, but still on the ground, the policies in several areas were missing. So things that are really, there's a clear disconnect between the spatial distribution and the policy distribution. This was Mexico City. I personally didn't expect much from here, but in terms of walkability, Mexico City was also doing quite well, but not so much in terms of the other indicators, and the same for policy distribution as well. This was a snapshot of 3 cities. Our pilot study had 25 cities, and since then we've also grown to other cities. Some of our key takeaways. So where we found gaps in policies, in terms of healthy living environments, land use, density, and for making safe neighborhood environments. Those were some of the key important gaps that we found in almost all of the cities. Inclusive environments. We found absolutely no mention in the 25 cities of how these policies support disabled populations. We don't see that much, but it's such an important topic. How do disabled populations access amenities? How are their neighborhoods designed? What about public transport access? We don't see that much. Same goes for aging populations. We find vulnerable groups often are excluded from these policies. There is no mention of any specific policies that addresses accessibility needs of this disabled population. And then there are hidden disabilities as well. So it's not just physical, obvious disabilities. It's also, how do we treat mental conditions? Increasingly, there's loneliness, depression, those are hidden. And quite often, city environments are very stimulating. There's noise, air pollution, there's a lot going on. So people with disabilities, there was absolutely no mention of those in these policies. And then children as well. I started by talking about how our children are really suffering and environments are excluding them from the design. We often find that designing for children is becoming an afterthought in our public spaces, but it has to be intentional. It has to be well thought out from the beginning. So these were some of the four highlights that we found. I think that's most of my work. I just wanted to acknowledge some of our key partners for this project. I can go through some of the slides again with the Healthy Sustainable Cities Observatory work. If you'd like, I can pull up the website. But I first wanted to open up for questions, for questions you may have.
Yeah, how does it work with the cultural differences?
Yes.
I mean, for example, the city of Milan,
Yes.
the idea was to develop the differences in the function of the lifestyle. Okay, the community, people that live in the States, people from South America that like to make barbecue. I mean, is this the impact of the cultural differences in habitats?
Definitely. I think there are contextual differences in our new, so the 25 cities are a pilot. In the next phase, we have added a section where we are mapping cultural differences as well. But this is where I think we need to involve the local municipality, the local residents to understand what the differences are. Because on the surface, if we just do a policy scan, we're just looking at the municipal documents. But we are not talking to people, we're not engaging with them. But I think that's where, if, for example, if you're redesigning the square in Pavia, it is important to go out, speak to people, understand what their needs are, the locals, the visitors, what different needs are. We are seeing it in some, so for example, if there are coastal towns, sometimes the policy has more either funding allocated to the coastal areas, so they budget in a way that those policies favor the high-risk areas, but not always. We are seeing it in some coastal towns, for example, in Bangladesh, in Sri Lanka, some of those high-risk areas, also in the US, where there are hurricanes, wildfires. Yeah, so those, but then it really depends on the municipality and how they frame their policy. It doesn't always happen. But I also feel if we do it in a soft design way, sometimes, yes, that works. Like tactical urbanism is one of the movements, right? Where street intersections are being transformed, they have pocket parks. It all happened during the pandemic. So it was temporary. A lot of cities went back on. I know cases in the US or Canada, for example, which are very car-oriented cities, but they converted the parking lots into open spaces. But as soon as the restrictions were lifted, they're back to being parking spaces. So that's my personal experience is unless there's a policy in place, things can change anytime. And design will also change and adapt. And if the municipal departments aren't talking to each other and if they're not governed by a single policy, then each one is free to do whatever they want. And that's how it generally goes in our city. Community education through interactive events. I've seen that as well. That's also important. So before a policy is introduced, if the municipality organizes some of these neighborhood events or civic, drives to educate the people, then the policy is better received by the locals. Yeah.
I come also from Athens, and the neighborhood where I stay in Athens is one of the most densely populated areas in Europe. For those who know City, of course. And I think that the minimum, the amount of public space that, per inhabitant is 1.5 square meters, which is very low. So I was thinking, what the alternative would be if we cannot demolish some buildings, what the alternative would be in order to extend the functions of the public space, for instance, and enclosed space function as a public space, or how we can extend this kind of public usage to public space in
Yeah.
where we don't have the capacity to use the public
I
space.
understand. Sometimes I have heard of shared use or joint use. So for example, schools that have playgrounds, they're used during the day. And at least in some countries, the schools, they have, strict boundaries and they're closed off in the evenings, the gates are locked. But if those those spaces and playgrounds can be opened up for neighborhood use. So those kinds of creative ways of using spaces that are otherwise just dead might be a way. In countries where there are a lot of high-rise, high-dense buildings, I know it doesn't easily translate, but there are vertical gardens where in buildings there are common areas that are converted into outdoor spaces. Those are some of the examples that I can think of, but it's not easy. I agree. Yeah.
But also, for instance, for vertical gardens, well, when we have the 300 group, I'm sure that some people are aware of the familiar with that. We can use the vertical aspects of the buildings in order to have more have accessibility to the to enlarge the public parts and make it more effective. But
not always, because I think in several of these high dense locations, housing is more in demand than public space.
Exactly. Or even parking lot, as Ashley said.
Yeah. Then I think with the parking lot, we still have some argument. But in cases where even housing is in high demand, then the question becomes, do we build more houses here or how? But it has to be a delicate balance, I think. Because the quality of housing is also determined by the windows, the air you breathe, the nature you have access to.
This is a research you're still working on.
It's an ongoing project.
Is there any further step, analysis?
Yeah.
The analysis on the design of the kind of projects, the quality they create.
Yes, so our goal is to first create the spatial indicators as well. We're also partnering with a lot of the municipalities where we first created the scorecards, and then we're going back to map them, because the first mapping was done, I think, 5 years ago. And things change in 5 years too. So we're now creating a system where we're beginning to regularly track policies. And our goal is to get to 1,000 cities. So it really is sort of an observability. And these are some of our cities, but not all of them have reached the final stage yet. We have about 135 cities now.
It's just members to this.
Yes, to the yes. And it is open to anyone.
So we can participate.
Yes, we don't have any Italian cities. At least as of now, I'm not aware of any Italian cities.
And what do you need for the?
We actually have all the tools. So what we need is some ground truthing. So you can help us check the policies, fill out the database, fill out the policy checklist, and then we help you create the scorecard. And then for the spatial work, it's a bit more work, because we need somebody with GIS skills here who can help us create the spatial maps for whichever city you choose. Yeah. Yeah.
Can you talk to Carol's question about whether the methodology, the cross-sectional throughout all cultures, continents, and climates, everything. I'm wondering how you respond to that. It occurred to me as I was listening to your amazing presentation, say, the indicators that are being used globally. For instance, we have the GDP, which I'm certain critical.
But there is also the NHI, which is the National Accuracy Index,
Yes.
which is quite close, I would say, to some of the indicators we're looking at.
Okay.
And, I'm just wondering how we take into consideration the, social, historical, cultural, aspects that contribute to, the well-being of people in different parts of the world. We take into account this as well.
So in our policy checklist, that's the tool we use. We do have a separate section for each city to add some of these context-specific factors. So for example, if a city has a particular historical event that has occurred or something that has informed a new policy, if a city is in an extremely hot zone, hot and climatic zone, we ask them to add it. In the first iteration, our goal was purely to look at the city planning documents without looking at history, culture, all the background stuff. It was purely a scan of the policy. But in the next step, we are doing this. So we are encouraging cities to add some of the unique elements that they have that we need to be aware of when analyzing the policy. We did not have any climatic indicators in the first iteration as well. But in the second one, we are adding, for example, does your city have a heat action plan? Does it have a flood control policy? What are the policies for disaster mitigation? We are including those in the next iteration. But yeah, there is still room for improvement. And if you would like to take a look at the tool and suggest, we will be very happy to take that on board.